All right, everybody, welcome back to the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott. With me here today is Tony Bonvecchio. Tony is a local powerlifting coach. He's had quite a career in strength and conditioning. He worked with Eric Cressy for a long time, and you worked with pro baseball players. You yourself have been a very competitive powerlifter. And the unique story Tony has is he had his hip replaced at what age?
36.
36. And so that was just over a year ago now, right?
Yep, April of 2024.
And you're back to competitive powerlifting, squatting, deadlifting, all that with it. So the reason I wanted to have Tony on today is he's a very well-educated powerlifting coach and someone I would trust with any of my athletes, and we actually share a couple athletes. And the other piece to this too is I have had my fair share of hip problems with FAI or femoral acetabular impingement, as many people know it, or impingement syndrome. I have ankylosing spondylitis, and my hips have been getting worse. And I have been looking at getting a hip replacement as well because I just went and got x-rays and actually have grade 4 out of 5 arthritis in both my hips now with significant cam lesions and everything. So I was looking at that, and I actually reached out to Tony a few months back, and we had a long, helpful conversation about what the process has been like, what it's been like to get back to training. So for any of you younger people out there that have issues like me and Tony do, I wanted to share this as a resource for you of some things to think about and consider, and just know that even if we have to have surgery to age younger than sometimes we think, things can get better. And sometimes it is worth it to have a surgery, even though a lot of physical therapists, including myself, want to stave people off from surgery unless it's absolutely necessary. In this case, it seems like it was, and we're doing much better now. So, yeah, Tony, thanks for coming on. So, yeah, tell us a little bit about your story of how you, how this all came about.
Yeah, it was a long process for sure. Nature versus nurture. There's pieces of it, for everybody. And I think mine was more nurture than nature. It's hard to call, wearing your hips down to the bone nurture, but you know what I mean. So I started playing baseball at a young age, and I was a catcher. I played 4 years of college baseball and segued into powerlifting kind of before my college baseball career was even over. I fell in love with strength training via college baseball. I lifted a little bit in high school, just like at the local fitness center, just kind of doing the machines and stuff. But once I got to college as a freshman, our coach gave us an off-season training program, and it was just a very stereotypical, like bodybuilding, like 4-day-a-week program. Not ideal for sports performance, but it was my first exposure to any sort of like barbell strength training. And I absolutely fell in love with it. I was undersized, underskilled. I walked on at a Division II college baseball program at Southern New Hampshire University, and I was way in over my head as somebody who grew up in the sticks of Northern Vermont. And I really needed something to give me an advantage and give me any sort of prayer of having a meaningful baseball career. And strength training was that. Very, very hard worker, but I'm 5'6" on a good day. I think I walked into college weighing about 180 pounds. I think after our first fall season, I was down to like 175 pounds from all the conditioning we were doing. So I just needed something to give me a little bit of an edge, and strength training was absolutely that. Fell in love with it. Put on a lot of good muscle right away, got much stronger. It helped me hit the ball further, throw the ball harder, run faster, all the things you would expect somebody to experience had they not done any strength training before. Around like my junior year, I transferred to a little school in Vermont, St. Michael's College, closer to home. It's still a Division II baseball school, but played mostly a Division III schedule. So it gave me the opportunity to play more and just have a more fulfilling experience as a baseball player. And that's when I started to train a little bit more like a power lifter. I came across a lot of Louis Simmons stuff from Westside Barbell, a lot of Joe DeFranco's stuff that was kind of taking the conjugate method and kind of applying it more to athletes, mostly football players, but still I gravitated towards that style of training because I love training heavy. I love training hard. And I think those two things in conjunction, being a catcher for as long as I was, and then really embracing heavy barbell strength training, that kind of set the tone for a lot of wear and tear. And I started competing in powerlifting in 2010, so pretty much immediately after I graduated from undergrad. And, fast forward several years, it was really in like 2023 that I started to experience pretty significant hip pain, mostly while deadlifting, but also while squatting a little bit, and tried to manage it conservatively. I would regularly go to physical therapy just for maintenance stuff, mostly soft tissue work, dry needling, stuff like that seemed to keep my symptoms under control. But I was signed up for a meet, I want to say maybe it was 2022, that I ended up having to back out of because of my hip pain, and was just hoping that I could manage it conservatively, train smarter, pay more attention to movement quality via, just warming up more effectively, trying to listen to my body as much as I could, but it wasn't getting better. And it was my right hip, the hip that I would, sit into most. I tell people I probably caught hundreds of thousands of fastballs from right-handed pitchers away from right-handed hitters, so just shifting into that right hip over and over in a position of a lot of adduction and internal rotation. And over time, coupled with all the heavy lifting that I did following that, I think just the wear and tear became too much. So kind of a funny story. It was over Christmas time, I think 2023 into 2024. I was experiencing like really, really bad abdominal pain on my left side, so opposite to the hip that was bothering me. And I thought it was a kidney stone. I'd had a kidney stone before, and as anybody who's had a kidney stone knows, it's an absolutely miserable experience. And the first time I had a kidney stone, I went to the ER, I sat there for like 8 hours, like lying on the floor in agony, only to find out that the kidney stone was small enough that they just sent me home. They said, take NSAIDs, you'll pass it on your own. So the second time, I'm like, I know what this is. I'm just going to manage it conservatively. So I was taking Advil at night, having such a hard time sleeping, lying on my back, hurt my hip, lying on my side, hurt my abdomen. And after struggling with it for like a week or so, finally in the middle of the night, I elbow my wife. I'm like, I'm going to the ER. I'm getting this taken care of. So I go to the ER. And when I finally get seen for this self-diagnosed kidney stone, I get a CAT scan, and I'm lying in the recovery room, and the doctor comes in, and the doctor says, well, there's good news. There's no kidney stone, but does your right hip hurt? I'm like, fuck yeah, it does. It hurts really, really bad. So it was the imaging that I got done thinking that I had a kidney stone, which was not, which they think might have been a stomach ulcer, which, if you know anything about GI health, one of the worst things you can do is just like slam it with anti-inflammatories. That was probably making it worse. Anyways, that went away on its own, but it was the imaging that I got done that finally revealed that my right hip had some pretty serious degenerative changes, had really advanced arthritis, some changes to the femoral head that were pretty much irreversible. I had a torn labrum. So that imaging led me to then go see an ortho, get all the necessary steps done to get a firm diagnosis. And by the time I met with the ortho, kind of the conclusion that my hip was too far gone to take any sort of just more conservative approaches. Cortisone shot wouldn't have done much. I wasn't going to, physical therapy my way out of this situation. So really the only option left, if I wanted to get out of pain and continue to be able to power lift competitively, was to have my hip replaced. And that at the time was super jarring. Like you said, age factors into it. I'm like, I'm only 30 at the time, 35 years old. It seems like I'm too young. But, your biological age is just one thing, right? We talk a lot about biological age versus training age. And after just beating the shit out of my hip for 20 plus years, it made sense that I was kind of, coming to terms with what my activities of choice had led to. So I knew that, number one, I couldn't be in pain all the time. I couldn't sleep because when I would lie in bed at night, that pain in my hip would just like radiate down into my knee and my shin and my foot. I'm the dad of two young kids, so the hip pain was massively inhibiting my ability to be a good dad and be a good parent. Hard to play with my kids, hard to get up and down off the floor, hard to carry my kids around. So not only the training side was being affected, but my everyday life was being negatively affected as well. So I elected to get the hip surgery. I got my hip replaced on April 8th of 2024. So I'm a year and some change removed from that hip surgery, and N equals one. I'm only one situation, but my experience was incredibly positive. My surgery went very well. My recovery was pretty fast. I had a great ortho, a great surgeon, a great PT to help me post-op, and I was back to training pretty quickly. You know, I was out of work for about a week. The first time I drove, that was kind of a trip. There was some of our members were competing locally. I live in Providence, Rhode Island. They were competing in Pawtucket, so about a 10-minute drive. So I think like 6 days post-op, I crutched my way into the front seat of my truck and managed to drive the 10 minutes down the road to Pawtucket, Rhode Island, and then was back at the gym that Monday, hobbling around on crutches. But I want to say after like 3 or 4 days of being in the gym with crutches, I was able to walk around unassisted. I did my first upper body training session 7 days post-op, and I did my first lower body training 12 days post-op. So very fortunate to be able to get back into the swing of things relatively quickly. But it was a big wake-up call for me in terms of just the way that I was approaching my training, mostly from like pushing through pain, you know. Mm-hmm. And I think I had a lot of good knowledge, and I think as a coach, you know, I knew better than I wasn't treating myself the way that I would coach my clients, right? Yeah. I was being much more aggressive with myself, much more, you know, hard-headed with pushing through pain, and like, okay, I can do this. If my pain is, you know, below a 7, I'm going to keep pushing hard, and then it would get a little bit worse. It's like, all right, well, if it's like below a 8, I can keep pushing, and it just kind of like snowballed like that. And post-op, I made the promise to myself to just listen to my body much more intently and remember how bad it felt to continue to push through pain, but see my performance continue to regress. And I think like it was before I'd gotten my diagnosis for my hip, but there was a very specific training session that I'll remember forever where, you know, as somebody who'd squatted over 600 pounds multiple times in my life, I think I had like 385 on the bar, and I was just like absolutely struggling to do like sets of like 2 or 3. The pain was like so intense. I remember just racking the bar and being like, this is stupid. Like, what am I doing? Yeah. You know, I'm pushing through this high level pain when I'm operating at like 50 to 60% of my capacity. And that's when I kind of realized that I needed to take some more firm action towards fixing myself.
Yeah. It's interesting too, because like when I was in school, everything was what we call the biomedical model of basically like you have imaging that says this, like it must be this. There's a direct correlation. And then when I was exiting PT school and looking at all the new things out there of pain science and this and that, it's like, well, pain isn't everything and imaging isn't everything, and it's all in your head. And then a lot of younger clinicians, and still even now we see clinicians and coaches that know some things but not enough things almost, are like, yeah, pain's fine, it's normal, like keep going through it, or like, you know, your imaging doesn't matter and all this. And I used to kind of think that too, but wasn't always sure. And now, like, for me and what I've been dealing with now, it's like, oh, this stuff does matter, and our training does matter. And, you know, it's interesting because there's a lot of, I want to hear your thoughts on this too, of like these days, you know, we promote strength training for all its benefits and everything. And like, it can be good for joints. It can be good for tendons, ligaments, everything. But there's also a point where we've gone too far with it. So like, what is your reflection on that?
You know, pain is obviously incredibly complex, and I'm not going to pretend that I know a lot about the, you know, biopsychosocial model of pain. It's not really my realm, but I have to be at least vaguely familiar with it and be able to communicate that to clients, because like you alluded to, if you're going to perform at any sport at a high level, you're going to deal with pain, even if you do everything, quote unquote, the right way. You know, you do your warm-ups religiously, you stay on top of your range of motion, you adjust the weight on the bar accordingly, you adjust your training sessions based on the pain that you're experiencing. But it's a pipe dream to think that you're never going to deal with pain, especially if you're competing in any sport at a very, very high level. I didn't compete in baseball at a high level by any means, but I just played it for a long time. Your experience with hockey, similar, right? Like, I think being a catcher in baseball and then being a hockey player of any kind, that's probably the worst sports that you can choose for long-term hip health. Just the nature of this. Yeah, right. You were a baseball player as well. So the nature of those sports is just going to be degenerative in a way. So yes, you have to be able to explain to clients that there is a expected level of pain that you're going to have to manage, but the idea that you're just going to like push through at all costs is not the right choice for most people, especially in strength sports, powerlifting, strongman, Olympic weightlifting, whatever it is. Even the most elite of the elite are not making really comfortable living. They're not creating generational wealth like a professional athlete in like the main four sports, right? So rarely is it worth it to kind of ruin your quality of life in order to perform at a high level. And I've also learned that the clients that I work with, we use powerlifting as our main means to drive fitness. But not everybody, very few people need to train like a powerlifter who is competing at a national level in order to achieve the level of fitness that they're going for. So I think post-op, I'm more likely to adjust things sooner with a client who's experiencing pain, rather than taking the approach I would have taken with myself and being like, well, if it's below like this threshold, then let's just keep going. Because in the grand scheme of things, it's like most people don't care if they are switching from a back squat to a safety bar squat, or switching from a barbell conventional deadlift to a kickstand kettlebell deadlift, just like trying to preserve the training effect as much as possible. But I think I had it in my head that if I were changing exercises away from like the big, heavy, fun lifts, that people were going to get pissed off. And I realized that people are more likely to get pissed off if their quality of life is negatively impacted by the training that they're doing that's supposed to enhance their quality of life. So I had to kind of detach my own biases from what I think of as these very fun, exciting, fulfilling lifts, and gearing people more towards stuff that's just going to make them have a better experience with less pain outside of the gym. That seems like an absolute no-brainer, and I think that I've gotten better at that. Even before I had my own hip problems, I had done a good job detaching myself from the pedestal that these lifts are often put on. But even more so post-op is just like, let's make an adjustment. Let's change things. Let's try to make this training session as productive as possible for the training effect that we're going for, but also make it so that the rest of your life doesn't suck just so that you can do this big barbell lift.
Yeah. My thing too, having reflected recently, is like, some people love surgery, and like it's like the first thing they want to do, the moment they feel pain, is like, let me go to the ortho, and like if they find anything, like, yeah, surgery it is. And it's like, well, hold on, like just because you have MRI findings doesn't mean necessarily that. But in the same breath, or for me as a physical therapist that deals with all the time, like people come in, I'm like, yeah, dude, like we've been doing PT, you got the imaging, it lines up with the findings, you are someone that's definitely a candidate for surgery, and they're so scared to have it. And it's like, my thing I've been trying to get people to realize now too is like, and I think for people like me and you that are training at a higher level, it's very easy for us to see a decline in function and performance, just because it's like, yeah, if you're squatting 600 and now you're squatting 385, it's 60%. And it's like, I'm at 60% of what I was capable of a year ago. It's easy for us to see like, yeah, this is a problem. And it's just starting to interfere more and more, where some people aren't training like that. They don't see it, but it's like, hey, you've stopped doing X, Y, and Z. Now, like, I know you don't want surgery because there's risks involved, but how much are you risking by continuing to have a functional decline for your sake of activity and just social involvement and participation of things that make you happy, in terms of your physiological health, of, inflammatory levels and just cardiovascular health and decreasing your risk of comorbidities later on. So these are all things like I'm thinking about now and like trying to get people to see too, because a lot of people now are they're waking up to the medical model, but some people are like so against it now. It's like we've gone too far. And I'm seeing that with a lot of patients. They're like, no, I don't want to go under anesthesia because of the risk, what comes with anesthesia. I'm like, I have a woman now that can't do literally anything. She has stenosis at C4, 5, 6, 7 in her foramens and centrally, like around her spinal cord. I'm like, you need surgery. She's like, no, I don't want it. I'm like, okay. So it's just interesting. So yeah, what is your thought on like, or your experience been of like, how much were you, suffering before, physically, mentally, physiologically, maybe even, to like, what's life like now for you after having the surgery and rehab?
I was suffering a lot physically and mentally, because I had attached so much of my self-worth to my abilities as a lifter. So when that was reduced, that was really, really hard. I felt like I was losing a part of myself to not be able to lift at a high level. I do think that there is a stigma about surgery, and specifically that that surgeons are knife happy, that they see the smallest indication that you would be a candidate for surgery, and they want to push you that way because that's how they make their living. And I don't think that's a fair assessment. And I think that goes for any realm of health and fitness. There are a lot of people who want to be contrarian, and it's like, oh, big pharma, or like, oh, like big gluten or big dairy or whatever. And it's like
free Luigi.
These recommendations that are made as like general health recommendations. There's a group of people who think that like they have the secret or they have the hack. And that might be true sometimes. There might be certain specific people who might have better outcomes by doing things unconventionally. But in the grand scheme of things, like most of these recommendations are coming from a good place and coming from a place thinking of like the bigger picture. And that, I didn't have a choice with my surgery. There was like no other option. I was so far down the road of degeneration that the only way that I was going to be able to live a normal life again was to have surgery. There are probably far more instances where people have multiple options, right? Treat it more conservatively, go to physical therapy, get a less invasive procedure. I think you had spoken to the idea of like maybe you could get some sort of like resurfacing procedure, or maybe you could manage it with, you could try a cortisone shot first. None of that was an option for me, but most people do have options. But what I would say is that it's pretty similar to ripping off a Band-Aid, right? Like if you it's gonna suck for a little bit, but if you just get it done with, the upside is so much higher on the other side of the surgery. And, age is a big factor, right? A lot of people get it in their head that like, I'm not old enough to have this problem. But if you have the problem, you have the problem. And I think getting it done earlier, you have that much more time post-op to get back to where you were and to get beyond that. And that's certainly what I'm experiencing, and training age and prior activity has a big role in that, right? So like most people don't play 20 years of a sport, and then most people don't, segue right into another sport that beats you up. So for, my orthopedic situation at 36 was probably looked a lot more like somebody who's maybe more sedentary or a more recreational exerciser at 60, 70, 80 years old. And if you wait and you kick the can down the road, that's just that much less time that you have to recover and then get back to where you were before. So I think if people can get over the idea of like not being like old enough to have some sort of procedure done, then if they really can't get over that, then I think they're hindering their ability to have a long, productive, fulfilling training career, so to speak, post-op. So they just have to get that out of their head that they're not old enough to have something like this done.
Yeah, and the other thing too that I want to hit on that is, if you start to suffer, you can delay things for a little bit. You can change your training and things. And like, I've been dealing with hip pain for at least 15 years now, if not more. And it used to just be, if I squatted really heavy, it would bug me after for a day or two. If I went to do another like squat session, and then it was, those good days became less and less frequent. And then it was, okay, now I'm starting to notice it when I hinge and not just squat, and I have to keep changing my stance when I squat, and it gets narrower and narrower. And then it's, oh, now it's bothering me when I do split squats and any single leg stance stuff too. It's like, okay, this isn't good. And it's, for me, it's like, someone asked me the other day, because I'm trying to go have the hip resurfacing done bilaterally. And I want to talk about that a little bit too, the difference between the two, because a lot of people don't know. But I was like still deadlifting the other day, and someone was like, wait, you're deadlifting, but like you're gonna have surgery? I was like, yeah. I was like, they still hurt. I was like, I'm doing this more conservatively now than I was. It's like, I'd rather have it done now while I'm healthy, I'm strong, because if I go into surgery, the healthier and stronger and more fit I go into surgery, the way better my outcome is going to be. I was like, I want to go into that surgery as strong as possible. The longer I put this off, the harder my outcome is going to be. And I know it's inevitable that I'm going to have it. And for us younger people that need it done too, these things tend to last 20 years, if not longer now, with the new materials and stuff they use. So if I need to have it done at 35, right, and I need another one, I'd rather have it at 55 than wait another 10 years and have it at 65.
Yeah, I think that's a really, really, really important point. Both points, go into surgery as strong and healthy as possible so that you're ahead of the game post-op. But yeah, I mean, your outcomes are just project so much better the sooner you get it done, because you're younger and healthier. The surgeon said the same thing for me about 25 years out of this hip replacement, maybe a little bit less based on my activity of choice and how much of a jackass I decide to be over the next, now 24 years. But yeah, I can't imagine how much tougher this scenario would have been for me had, number one, I not trained hard all the way right up until surgery. And if I were, 55 instead of 35, I can't even imagine how much tougher that would have been. Pre-surgery, I did have to really modify my lower body training. The first thing to go for me was deadlifts. Like, hinging was incredibly painful because I just had like no hip IR or hip extension on my right side. So deadlifting in all of its forms was out first. I could still squat a little bit. Eventually back squats were off the table, but I had to find what I could push hard so that, number one, I could maintain my level of fitness, and number two, I could maintain my level of sanity. I'm a very goal-oriented person when it comes to lifting. I sometimes would rather not train at all than just like go through the motions. But for me, what I could train was Hatfield squats, so like safety bar on my back, hands on handles supporting me, so I could almost get into like a hack squat position, because like that narrow stance, hips behind knees, like very upright torso, that felt fine. So I'm like, okay, I need like a side quest here. So I gave myself a side quest of like, I'm going to Hatfield squat 700 pounds before surgery. And I did it I think 2 weeks before my scheduled surgery. And that let me still squat heavy twice a week, every week, pain-free. I just had to kind of dig a little bit for the exercise that jived with me. And it was fun. It was the most weight I've ever lifted. Obviously, it's way easier to lift heavy on a incredibly stable exercise like that. But had I not had that side quest to go after, I may have stopped training lower body entirely, and then of course my fitness level is going to degrade. I'm probably going to experience some level of atrophy. Maybe my bone mineral density goes down, and then maybe my post-op recovery is not as good. So, there's always something you can do, regardless of what type of ailment you're dealing with. As long as you're willing to get creative, I think there's always a way to find, Tony Gentilcore would call it like your trainable menu. Don't focus on what you can't do, focus on what you can do. And that's exactly what I did. When back squats were off the table, when deadlifts were off the table, I sat down, pen and paper, and just like wrote down, like, here's all the shit I can do. I can Hatfield squat. I can do glute ham raises. I can push and pull a sled. Here are the exercises that don't make me feel bad. And let me just like treat those like a competition lift. Let me just train the hell out of those, so I can maintain my fitness level and just maintain my level of self-worth, because I attach myself so dearly to training hard, and not everybody loves to train hard. That's okay. Some people like to train in a very casual, recreational way, because that's still good for you. That's still really, really good for you. It'll still probably make you live a long life with a high quality of life. But I need something that I can train with a competitive mindset. So it took some creativity on my end, but I found those exercises, so I was still able to train my ass off all the way right up until surgery.
Yeah, which is awesome. And the other thing too, kind of going back to what I was saying about the longer you put things off. So I have a woman now. She just came in yesterday for the first time post-op from a hip replacement. And it was, I think, 16 months ago, she came in for her initial eval. And it was a no-brainer that she needed bilateral hip replacements. But she was so terrified of the medical model. And she didn't want to go even get imaging. She thought we were going to somehow heal her. And she had been going to massage for, like, the massage therapist should have referred her out a lot sooner than she did. But anyways, she came in. I was like, look, you need hip replacements. And she didn't want to. I was like, okay, like, we can do palliative care here and like maintain joint health as much as we can. And things got more and more limited, but it's still like every day I would almost make her cry. I was like, you need to go get this looked at. She was like, don't tell me that. I don't want to hear it. Like, I don't want surgery. I was like, it's going to be the best thing for you. Finally, things got so bad, she finally agreed to go get imaging. And the surgeon said this is the most catastrophic degeneration he's ever seen. So mind you, functionally, her hip probably moved a total of about, I want to say 15 degrees of flexion. Like, it was bad. Like, no internal rotation, no external rotation. It was almost fused. And this has been going on for probably at least 2 years now at this point. So she just had her hip replacement. She feels a million times better. But the home rehab team was very concerned that, like, it was still really stiff. And I was like, well, yeah. Like, they didn't see you beforehand, so they don't know. And this isn't normal because you put this off for so long and you were in so much pain. But you've basically developed contractures from kicking this can down the road for so long, where it's going to take us a lot longer now to get all those muscles moving again, because it's not just the joint that's affected when you put these things off. It's that all the muscles, the tissues, the joint capsules all become restricted with that limited movement for that long. So that's another thing too that people need to really think about and consider when they're putting off a surgery or some type of intervention to improve their quality of life and health. So
I think a lot of times too, the coaches and the medical team, if you want to call it that, the physical therapists, the massage therapists, they want to try to have a positive impact and be like, no, we can still work around this. Number one, from just like caring about that person and wanting to provide them with a service that makes them better. But also like from the business side of things, right? It's like if that person is out for X amount of weeks or months that they're not seeing you, then that's revenue that's out the door, right? That's not like a highly ethical way to think about it, but I think like subconsciously, it's always in the back of our minds. It's like, if I can continue to train this person that's, money that continues to come into my business. And it can be kind of hard to like let that person go, even if it's for the greater good. I think very similar to the way that the person who is a candidate for surgery needs to think about the long term. It's like, okay, if I get this done now, my outcomes are going to be better down the road. Same thing for the business person, the coach, the PT, the massage therapist. If you are willing to part ways with this person and the revenue that they're bringing into your business now, they're going to come back sooner, and that's going to be a greater lifetime value of that client down the road. Whereas if you hang on too long, you might lose that person, right? And they might lose trust in you as the coach or the clinician, because it's like, well, why did you drag me through this for so long? And it sounds like that's probably less common, right? Like more people are probably more likely to beg you to keep them. It's like, I don't want to get the surgery. Like, I want to stay with you where I'm comfortable. Yeah. And it's a little bit less scary of an experience. It's certainly less scary to push through some pain while squatting than it is to, get on the operating table and have somebody cut you open. But I think when you have your business hat on, if you think more about the lifetime value of the client and what they're going to bring to your business post-op, if you get it done sooner, I think that's the best case scenario, if you're just willing to part with that person's business in the short term so that you can have them back in the long term.
Yeah. And for people that aren't the health professionals or fitness professionals, like, you have to consider being on the other side of that too, of like, if you're seeing, it could be a physical therapist, because there's a lot of physical therapists still that like don't believe in surgery or think we can be miracle workers when we can't always be miracle workers. Like, sometimes we have some crazy things happen that people get better, but like when it comes to, stage 4 or 5 arthritis and these things, like, they typically need surgical interventions. So if you're trying something to improve yourself, great. And I think we should all exhaust all options before we go to surgery. So like, I've saved so many people from an unnecessary surgery where, like, I literally had a guy last year come in. He's a weightlifting coach. He messaged me literally it was a week before he was going to have a labral repair on his shoulder. He's like, hey, you're a weightlifting coach and a PT. Can you look at this? I was like, yeah, like, come down. I'll just take a look at it. I was like, dude, you don't need shoulder surgery. I was like, this is all your symptoms are coming from your neck. I literally manipulated his neck, gave him a few like neurological resets for his neck. He was PRing a snatch the day of a surgery, or what should have been a surgery. But in the same time, it's like, okay, you've tried physical therapy, you've tried this, you've tried acupuncture, cortisone, nothing's getting better, go have the surgery. But I tell people, like, you should look at all things. And if you're seeing someone for more than, I would say, 4 to 6 weeks and things aren't changing, either find someone new and different or take the next step towards something different.
Yeah, there's rarely any harm in trying to work around an issue and trying to take more conservative means. But at some point, you have to be honest with yourself. Everybody has to be honest with each other. And, I think egos run rampant in our industry, right? And people thinking that, like, I have the answer. I've seen this before. I can fix you. It can be hard to set that aside and say that, like, I don't have the answer. Rarely any harm in trying, but yeah, like you said, if symptoms like really don't improve over a fixed period of time, then that should be kind of the wake up call that you gotta take a more, you gotta, refer out, is what they always say. And I think some people are probably like too quick to refer out. It's like, as soon as like something comes in where, symptoms are aggravated or whatever, it's like, okay, like I can't help this person. Like, no, you could probably help in a way. But yeah, setting the ego aside and saying, like, okay, it's time to pass this person on to somebody else. I think that's a really important quality for coaches and clinicians to have. For sure.
Anything these days too, that you are now limited on that you couldn't do before? Like we talked about, I asked you about running. You're like, well, I've never run. I don't ever plan to run. But any restrictions or anything that having the hip replacement has put on you?
No, I'm very, very lucky. I'm back to 100%. My hip motion is way, way better than it was before. I can still sometimes feel some stuff, mostly like when I'm in like really, really aggressive, like hip extensions. Say I do like a pretzel stretch. Not named after you, ironically, it should be, but it's not.
I have a client that calls me Dr. Bretzel because I gave him that years ago, and he still calls me Dr. Bretzel all the time, but it's Brett Jones.
Yeah. So if I do like a pretzel where like I'm lying on my right side, I guess either side. So if my hip is in like a lot of extension or a lot of flexion, and then I go into a lot of like T-spine rotation, like I can feel that I have a fake hip. But that range of motion is like not anything I would ever get into while like back squatting or deadlifting. Again, N equals 1, but my symptom relief was instant. As most people familiar with this kind of thing know, like you're walking the same day. It's a hip replacement is a outpatient procedure, which is pretty wild to think about. But you're walking with a walker or crutches the same day within hours of the surgery, and all the internal pain I was experiencing was relieved immediately. Obviously the incision site was painful. They cut you open, they saw the head of your femur off, they screw a new femoral head into your pelvis. Like that shit hurts. But any of the pain that I was experiencing while lifting, I could sleep again. That was nice. Huge. As we know, like tissues regenerate while you're sleeping. So aside from just like the pain I was experiencing and then the continued trauma I was applying to myself by continuing to train hard, that was all just compounding because I wasn't recovering from anything, so then like my body's not recovering. I'm underslept, I'm grouchy. That affects the way that I, interact with my family. When you've got 2 young kids, like sleep is hard to come by anyways. So it's just like a perfect storm of, suboptimal recovery. So yeah, I'm not limited with anything. I've been able to, kind of like adjust my squat stance a little bit. Post-op, so pre-op, I had like a pretty gnarly hip shift in my squat, just because like, again, I had like no IR on my right side. And obviously to achieve depth in a squat, you have to have a lot of hip external and internal rotation. So I found myself just like shifting into my right side a good deal. That was still there post-op. But I was smarter about it. I started by squatting to a box, a relatively high box, I think like an 18-inch box to start. And then each week I would just like bring it down a little bit. And by the time that I was squatting without a box again, it took a little while to kind of like reprogram the squat pattern in my brain to no longer hip shift. But like you alluded to, it's like you think that like a narrower stance squat is more range of motion demanding, right? But like when you squat out a little bit wider, I think that is more challenging from like a proximal hip standpoint, right? Mm-hmm. And the wider you stand, the harder it is to achieve ideal squat depth without running into some sort of like bone-on-bone contact. So my squat stance got narrower and narrower pre-op. Post-op, after a little while, I was able to bring it out a little bit wider.
I was just going to ask you that.
Yeah, and when it comes to powerlifting, I would say most of the best squatters take a semi-wide stance, right? It's a bigger base of support. You're able to hinge back into it more, so it becomes a more hip dominant squat. But you do see some really high level squatters, especially lighter weight lifters, especially lighter weight women, who take a very, very narrow stance. My squat stance is still quite narrow, and I don't out toe much at all. I squat in a squat shoe, a 1-inch heel elevation, which helps a lot with the more upright stance. But what I found pre-op was that like with that really narrow stance, I found myself just like when I fail a squat, I'm not the kind of lifter who fails a squat by like dumping forward and like losing my upper back position. I would always have my hips fade back, so my knees would extend much faster than my hips. I'd still stay pretty upright, but instead of losing the bar forward of my center of mass, I would lose the bar rear of my center of mass and fail squats that way, almost like sitting back too far onto a box squat. If you do a box squat and you sit like way back, like I'm sitting here in a chair right here at about like, 75 degrees of hip flexion. I can't stand up off the chair. Somebody who squatted 600 pounds, like the leverages are not there, right? In order for me to stand up, I have to lean forward a little bit and then I can stand. And what I found was post-op, I could widen my stance a little bit, hinge back into the squat a little bit more, which just allowed me to be like more stable overall and kind of helped me with that like early knee extension. So having my hip replaced just gave me more options for squatting. And like you talked about earlier, when you're in pain and you're trying to work around pain, sometimes your available options for exercise selection get reduced. But on top of that, sometimes your options for execution of an individual exercise get reduced, right? So you change your technique. And the deeper you get into your strength sport of choice, the more ingrained those patterns become, right? And that's a good thing. You come into your own technique, and it can be kind of a mind fuck when like you then have to change that pretty significantly in order to work around pain. So I think that's where a lot of my strength loss before the surgery was coming into as well. Not only was I dealing with pain, but I was having to modify my technique where it was becoming a very, very different exercise. So not only am I pain-free now with greater joint range of motion, I have more options for how to execute my exercises, which has been extremely helpful.
Yeah, and pain's inhibitory. So like the hardest part for you is probably, and sometimes the body is very good at compensating, right? But you compensated and sank into that right hip for so long, like trying to fix that hip shift after surgery was probably the hardest part of rehab for you to get back to like a more of a balanced squat, I guess, right?
Yep. So like I said, for context, I've squatted over 600 pounds a couple of times in training, and, pre-op, I was down to the mid to high 300s for what I could handle. So a very, very significant drop off. I got back to a 500 pound squat 16 weeks post-op.
That's crazy.
So in the grand scheme of things, like not that long, right? Yeah. That first 500 pound squat was ugly. I look at the video of it.
I watched your videos before of this to see, because I saw you had posted about your year anniversary with your new hip, and I was like, wait a second, you had a hip replacement? And I was watching, I went back to like pre-op of where you were and was looking through your videos, and then I saw you hit some big weights, and I was like, okay, that's a significant hip shift. And then I went back up further the page more recently. It looks like that has corrected, and the squats don't look like they were like very near post-op.
Yeah, I think I was pretty smart with the way I approached it. I was still aggressive, right? And that first 500 pound squat post-op was not very pretty. The hip shift was still there. But I think a lot of that just came from apprehension as well. And I don't want to make it sound like I was like fearless and I was like, I'm going to crush this. And I wanted to get back to my strength levels prior to surgery as quickly as I could. But there was a lot of apprehension there. Some of it was pain related, but I would say more of it was just like the anxiety of not having had that kind of weight on my back in so long. So I think once I built that confidence back up, then I could just kind of like let the squat happen instead of being so like focused on technique, because anybody who understands motor skill development knows that the more you think about a sporting task while you're executing it, probably the worse you're going to execute it. So when I got back to squatting, I was thinking a lot about, what are my feet doing? How are my feet interacting with the ground? How am I stacking my ribs on top of my pelvis? Am I staying braced? Am I keeping balance over my midfoot? So I'm thinking about squatting. And once I was just able to have some success with heavier weights, I was able to just kind of like let it happen and execute again. And that led to my technique being much better. And I think if you look at, my squat videos pre-op and my squat videos, like 3 or 4 months post-op, there's a big difference in technique. My hip shift has reduced a lot. That hip shift was leading to like a lot of bar tilt, which obviously is not ideal. You want the weight balance, over the middle of your foot. And if you're experiencing like a torso shift, that's going to compound everything. So everything's just like much more balanced, much more symmetrical now, which allows me to just get under the bar and execute instead of having to think about all these little intricate details. You can't be thinking about like, what your fucking big toe is doing when you're going for a 1 rep max, right? You just have to like go to a dark place, get tight, get aggressive, and execute. And that was probably the slowest thing to return for me. It took some time.
Yeah. With that being said too, like, yeah, I see a lot of like people that are advancing and progressing pretty well with lifting and strength sports, like novice plus maybe. And it's like, they get so into it and it's like, you're thinking way too hard about it now. It's like, you're starting to learn things, but you don't know enough to realize like you need to shut the fuck up and just like do it and stop thinking about, yeah, where's my big toe in this? Like when you get to 90+%, like you just got to do it. And it's okay if the bar shifts a little bit and these things, like we can still get it done. There's no style points in weightlifting or powerlifting. So granted, we don't want to do that all the time maybe, but it's
weightlifting even more so than powerlifting because it's such a fast activity. Powerlifting is like incredibly slow by comparison to most other sporting activities, so you probably can have like a little bit more of an internal focus when you're thinking about technique and cues and all that stuff. But from my past career as a sports performance coach, when you're teaching kids how to jump and sprint and throw and stuff like that, there's no time for like internal focus cues. So you have to be like very externally focused or use like, constraints-based coaching in order to drive the technique points home. And even prior to my surgery, I was trying to incorporate a lot more of that into my powerlifting coaching. So I used that on myself, to get my squat back up to speed. I used a ton of tempo squats. I used a ton of like squatting to pins, things that just like forced self-organization into good technique, and that helped a lot too. I really hammered squats to pins. For me personally, that's always been something that's made my squat kind of get right even before I was dealing with hip stuff. So I just leaned on a lot of those supplementary exercises to kind of get back to where I needed to be. And I think that's useful for perfectly healthy strength sport athletes, and especially athletes who are coming back from some sort of injury, because that level of apprehension interferes with technique to such a high degree for so many people that if you just modify the exercise so that you get that instant feedback, whether you're doing it right or not, I'm a huge believer in that for athletes across the board. Yeah.
Another thing too, I know you're not going to be a runner. Would you have any hesitation? Granted, we probably want to train up to it, but like, would you have any hesitation to like maybe go back to playing some type of field sport, like even like recreational soccer or flag football or something like that?
I just have no desire. I'm probably the wrong person to ask.
But
I think I could.
If you did, yeah. So for people that like I have people that, want to get back to playing hockey. I have a friend now that's a hockey player. I saw you on my schedule for today, and I have a friend that I think he's 36 too, and he's needed a hip replacement for a few years now. I texted him last night. I was like, dude, did you get this done yet? Because he'll come in. His dad had a bad experience with surgery, so he's scared of having surgery. But he's like, no, but I think I'm going to get it in January. I was like, all right. I was like, I got Tony coming on. He wants to get back to playing hockey. I have other people that, are always going to come in that want to do different things. So, yeah, would you have even... I know your motivation to do those things isn't there. But if it were, would you have any apprehension about just like based on the way your hip feels and what you know and the restrictions? Like, do you have any reservations about doing something with like multi-directional movement, sprinting, lateral agility stuff at all?
I don't think so. I think I would be fine to do that. I think that's probably the biggest mistake that, just healthy adult people make when jumping back into rec sports. Like, that's probably one of my biggest pet peeves, like, of my client base is like training's going great, they've got some big like competition or goal like on the docket, and it's like I get a text message or an email and being like, oh, like I pulled my hamstring because I like hopped in on like a rec basketball game. It's like, well, what the fuck? Like you got to work up to that stuff. And
golf's the worst.
Golf is not great. All the like obstacle course races and stuff like that. I understand that people have lives outside of strength training, but I think healthy, injured, whatever, you got to work up to that stuff.
Yeah.
And it seems perhaps like overkill to like, oh, I have to like ease my way into this very casual, recreational, physical activity. But it's just like lifting. You wouldn't take a year off from lifting and then go back into the gym and load up your 1RM on multiple different lifts. And like, if you did that and you got hurt, you wouldn't be like, well, what the fuck? I didn't expect that. Like, of course you would expect something bad to happen. So yeah, I think that anybody looking to get back into recreational team sports that involve, multiple planes of motion at high speeds, high impact, you just got to ease in like anything else.
I would say that for anyone, especially, I think in my mind, the worst two are golf and men's softball, or women's softball too.
Yeah.
Like this time of year or a couple months ago, like once the weather started getting nice, it's like we start seeing all these golfers come in with back pain, and it's like, what do you do all winter? It's like nothing. And it's like, oh, and then you decided it was a good idea to go hit 100 balls like as fast as you can in spinal flexion, extension, rotation, and side bending, and you don't have like decent hip internal rotation or external rotation. Great. And then softball is the same thing of like, yeah, pal, the warm-up wasn't 3 Bud Lights before the game and like, doing Frankenstein walks for a second and then sprinting as fast as you can to first base.
Yeah, I think as a younger coach who was more likely to just tell people whatever they wanted to hear to make them happy, I'd probably say like, yeah, go ahead and do it. And now I'm more likely to say like, yeah, go ahead and do it, but the risk is on you. Like you get what you get. Yeah. And I was just joking with a client the other day that like, pro athletes might sign like a big contract and there might be like a clause in there, like no skiing, no golf, just like you're not allowed to do any activity that might interfere with your demands of this sport that we're paying you like millions of dollars to go play. Obviously you never do that with, a recreational lifter, but I do make a point with my competitive power lifters that like when they've signed up for a meet and they're like 8 to 12 weeks out and they mention to me like, hey, I'm going to go play in this charity golf tournament, or I'm going to hop in on like this 5K that's, for charity or whatever. I'm like, that's great, but could you not like just this one time, just like say no, so that you can be at your best for this big competition that you have committed to. Because like you can do anything, but you can't do everything. Yep. And I would say like general strength training, general fitness probably does a good job. Like if the coach is good, if the programming is adequate, probably prepares you for a lot of things, but powerlifting does not. Training to be a powerlifter, training to be a weightlifter, probably makes you worse at changing directions and rotating and expressing force laterally. And that's okay. That's the choice that you make. The SAID principles, specific adaptation to imposed demands. If all you're doing is like compressing in the sagittal plane, like you're probably not going to be good at doing all the rotating and changing direction. But people have to be realistic about what they want, right? Yeah. And so many people that I train when they first come to me, they want a little bit of everything. And if that's what they want, I will train them accordingly. But if you want to power lift, like that's incredibly specific, and you're going to have to make some sacrifices for the other activities that you want to do outside the gym if you want to be good. And you just have to have a realistic conversation with that person so that they don't do several things poorly. Let's just do like one thing really, really good.
Yeah, my outlook on that too, like I have a similar conversation with my athletes where it's like, all right, like it's kind of like, what is your baseline? Like if you're hiking every weekend for an hour or two in the woods and you got a decent incline and you've been doing that regularly, okay, cool. Like if that's your baseline, you'll enjoy doing that. Know what effect it has on your performance on meet day. But if you want to do that, cool. But like, if you're going to do that stuff, my view, for someone that's not super competitive, like if we're not going for a national medal, cool. You want to do the things that like keep you socially, having fun and enjoying life. Yeah, go do them. But like you said, like, oh, you haven't played golf and now you're going to go do this tournament like 6 weeks pre-meet, like bad idea. It's like, sure, go do it. I support you, I guess, but here's the risk and reward of that. And so that's my thing too, for people to just think about, is like, if it's something you're physically prepared for and you've been training for regularly in some way, okay. If not, I would stay away from it.
Any good coach to athlete relationship is built on mutual trust, respect, and clear expectations.
Yeah.
That's so important. Everybody's worked for a boss at some point who has unclear expectations, and that sucks, right? You're getting yelled at for doing something that you didn't know you weren't supposed to do, or your performance at your job was not up to this person's expectations that were never laid out. Like, that's no good. So for a coach and athlete to have like a solid, productive relationship, those expectations have to be clear and honest.
Yeah. I tell people all the time, like, look, I can't do anything for you. I'm not you. I can't make the decisions for you. I'm like your financial advisor that tells you what happens when you put your funds in which account. And it's like, there's our, low risk, medium reward, or high reward, depending on what it is. And there's your high risk, potentially high reward, depending on how those people want to view it. And that's my thing on coaching. And yeah, it's like setting those expectations of, if you choose this is what it is. If you choose option B, here are the outcomes and things you have to look at and consider. So, but
I think it all comes around full circle to our original topic of getting some sort of major surgery. If you've gone through it yourself, like I have, I can lay out clearer expectations and give people a better idea of what their outcomes might be based on the route that they choose. If you decide to get the surgery, then here's what you might experience. Here are the risks. Here are the rewards on the other side. If you decide to kick the can down the road, here are the other risks that you are potentially incurring. So yeah, the experience, individually, or the experience of the coach, the more people you train who have gone through it, the better idea, or the better you can communicate it to potential clients down the line.
Yeah, absolutely. And I know we got to wrap up here in a minute. So any final things you wanted to add to this at all, Tony?
Again, N=1, but my experience with a total hip replacement was incredibly positive. I'm very glad I did it. And there is hope for anybody and everybody post-op. Surround yourself with a good team, get people in your corner who you trust. I'm very lucky that I had an ortho and a surgeon who work with athletes, who understand what my background was and what my goals are. The PT that I worked with, same sort of thing. I had a very, very long standing relationship with this PT prior to surgery. So he knew exactly what I wanted to get out of the experience. He understood what my goals were. He understands what my tolerance for risk was. So yeah, not only is it, the actual procedure, but just making sure you have the right people in your corner so that your results and your outcomes are as good as possible after the fact.
And who was your surgeon?
Dr. Drew, out of Beth Israel in Needham.
Not Dr. Drew Pinsky or whatever his name is, right? Not the one from MTV.
No, not that one.
Okay.
But yeah, Dr. Drew out of Beth Israel in Needham. I had a very, very positive experience. And shout out to Andrew Millett from Move Strong Physical Therapy in Hudson. I've known Andrew for years and years and years. He kept me on my feet, pre-surgery, with a lot of treatments that allowed me to continue to train hard all the way up to it. And he took good care of me afterwards and continues to take good care of me now. But I think people like Andrew, people like yourself who have a background in sports, have a background, or who continue to train very, very hard yourselves, I think that gives you such a wealth of knowledge and context for what your clients are going through. Finding a PT who lifts is really important.
Yeah. Thank you for adding that in for me. And then one more thing I have, actually. Did you, because we didn't get to it, but the whole hip resurfacing procedure versus hip replacement, did you look at hip resurfacing at all, or did you just go straight into the hip replacement?
It wasn't an option for me at the point because my arthritis was so far advanced and my labrum was torn. It just it wasn't an option for me. But I have coached people who have had the resurfacing done in order to avoid the replacement. I think it all depends on the type of FII that you have, the integrity of your labrum. I just had like really gnarly like bone spurs, and my labrum was completely shot. So that was not an option for me. But it does seem like a more conservative option for some people. So yeah, I didn't have it presented to me, but I understand that it is an option to avoid the total hip replacement.
Yeah, I'm going to try to have a surgeon come on to speak on that. But there'll be more for next time. So for those of you that aren't aware, for younger people, hip resurfacing is another thing that has had some controversy in the past, but it's actually what I'm looking to have done. And currently I'm fighting with my insurance company over me getting the surgery, because there's not a lot of surgeons that do it. And there's one surgeon in Massachusetts that does it. And from what I read, he basically drew the short straw to have to say he does the surgery, and like his primary specialty is oncology surgery. And I was like, yeah, I don't want the guy that drew the short straw that does oncology to be doing like sports orthopedics here on something that like, takes a lot of skill and repetition and things to do. So I'm fighting to go to New York to have mine done. So I'll do a podcast on that at some point soon. Maybe the next one. And Tony, where can people find you?
Our main social media platform is Instagram. So at Bonvec_strength. Bonvec is Bonvec. We put out a ton of content related to powerlifting, related to nutrition, related to just general strength training. That's where we do most of our stuff. You can find us. Our website is bonvecstrength.com. I put out a lot of stuff on YouTube. I have a mailing list where I put out a lot of free content to our subscribers every week. So yeah, Instagram, Bonvec_strength.
Awesome, man. And you're in West Boylston, Mass. So kind of local to us a little bit if you're in that area. And again, thanks for taking the time to come on. And I think you're the last of like the OG Cressy crew to come on the podcast. I had Tony G on a few weeks ago. I had Miguel on a couple months ago. I had Greg Robbins on like, I don't know, a year or two ago. I don't know. Do I got anyone left to get to besides the big man himself?
That's a pretty good cast of characters. It was a lot of fun. That was Cressy Sports Performance, launched my coaching career. I owe a ton to those guys for taking me on at a time in my career where I felt like I had a lot to offer as a coach, but I just didn't quite have the resume yet. So when I was there from like 2014 to 2017, those were some of the most formative years of my coaching career. So I owe a lot to those guys, and just a wealth of knowledge from all of those coaches.
Did you ever write for T Nation at all?
I did.
Okay. I have a coach now, Matthew. He's getting his master's. He's into powerlifting. I said to him a few weeks ago, I was like, he's like 24. I was like, yeah, I have Tony Gentlecore coming on the podcast. He's like, who's that? I was like, he was a huge blogger. He's like, he wrote on T Nation. He's like, what's T Nation? I was like,
oh, geez.
I was like, fuck, I'm starting to become part of the older generation of coaching here.
It's just a different time. It's a really different, it used to be like, that's how
that was the place.
That's how I was able to intern at Cressy, so
wow.
I got into coaching relatively later in life, in like my mid 20s, gave up a desk job in order to do the unpaid internship at Cressy. But it was largely, my undergrad degree is in journalism. I've been writing as a professional since way before I got into coaching. And that's how I was able to finance that internship, was just like multiple freelance writing gigs. It's just not like that anymore, right? The way that people consume content, like long form written content, is not like a viable means for like growing one's identity as an online coaching presence. So yeah, times are changing. Yeah, for sure. And I had Charlie Weingraf on the other day too. He's like my day has passed as far as my relevancy in a lot of ways with social media and things. But hey, anyways, when Charlie talks, I still listen. Every time Charlie comes across my feed, I stop and I listen, because he's still one of the smartest dudes out there. I take everything he says quite seriously.
Yeah, for sure. Definitely smart guy. So his episode will be out He's actually the one just before you, so you can look out for that one right below you on the Spotify list. But anyways, man, I'll let you go here. Thank you for your time, and appreciate you coming on and sharing your story with us.
Thanks for having me, Brett.
No problem.
84% of you that listen to this podcast frequently do not hit the follow button. If you've enjoyed any of these episodes, could you do us a favor and hit the follow button, leave a rating, and maybe leave us a review? It helps this channel more than you know, and the bigger the channel gets, the bigger the guests get. If you'd like to know more about training in person or online with Brett's Gym, Architect Fitness, please follow us on social at ARKITECT Fitness on Instagram or visit ARKITECTFitness.com. Or if you want to rehab with barbell therapy online or in person, check out @barbell.therapy or visit barbelltherapyandperformance.com. Thank you for taking the time to listen.